Сайн байцгаана уу хүн үзэгчдээ. Өнөөдөр манай de facto нэвтрүүлгийн зочноор Интермед компани одоо эмнэлэгийн гүйцэтгэх захирал ноён Джошуа Курциг оролцож байна. Good evening, sir.
Good evening. Nice to be here.
Thank you. Thank you for coming to the show. Let's talk about the Intermed. What is that about? And then I would like to ask more questions on your previous career.
Sure. Well, Jargal, it's very nice to be here, as I said. Intermed Hospital is Mongolia's newest hospital. We're just down the road, not too far. But the point of Intermed is to bring a new quality of care to Mongolians. The project was started a long time ago, actually, in 2008. And we've been working now for the last 7 or 8 years to build this hospital, and we finally opened in 2014. So we're brand new.
7 years it took.
It took a long time because we wanted to get everything right.
Yes.
What do I mean? What I mean is we need the equipment right, international standard equipment, international standard practices, international standard way of providing care to our patients.
Okay.
So Mongolia has a very, very good healthcare system. The doctors are quite good, but still people are going abroad for healthcare, as you know.
That's the problem.
I'm sure we're going to talk about that.
Yep.
What we want to do is we want to provide quality healthcare in Mongolia for Mongolians so they stay. So that's really the point of Intermed. We're a relatively small facility. We have 91 accredited beds. And we're a tertiary care facility, which means we provide everything from primary care, secondary care, tertiary care, complex surgeries, oncology treatments, and so forth. So we're new and we're growing, and we're very happy to contribute to the development of healthcare in the country.
See, you have touched a very important issue when Mongolians go abroad, spend a hell of money for the facilities that we did not have before.
Right.
And I understand now we have it, right?
I think we're moving in that direction.
Okay.
Let me give you some numbers as I know them.
Yeah.
In 2013, Mongolians spent something more than $100 million US traveling overseas. About 80,000 people went overseas, and they spent about $100 million.
Yes.
That's money that could be spent here.
Yes.
That's I don't know the number 2014.
Yeah,
I'm sorry.
no problem.
But it's a lot of money.
Yes.
And a lot of the times it's for specialized care, but not always.
Yes.
It could be for having birth, giving birth.
Yes.
It could be for things that Mongolia, I think, does quite well.
Yes.
But people are still uncertain about Mongolian healthcare system.
Yes.
When we had our opening ceremony in September of 2014, the then Prime Minister came and gave a speech, and he said he himself was guilty of having gone abroad for medical treatment.
Okay.
We want not only him and people like him, but also everyone in Mongolia to be able to come to Mongolian hospitals for medical care. It's a big issue. So we are starting to provide some of the services that previously people were going abroad for. For instance, we're doing very complex gastro surgeries, stomach surgeries, liver surgeries, kidney, pancreatic surgeries.
Which was not the case before?
Well, the public hospitals have been doing it, and the doctors are excellent. But to provide the kind of international standard care that Mongolians deserve, this is why we started Intermed Hospital.
See, two things. For example, expatriates living in Mongolia, if they had a problem, then there is a service, SOS medicine.
That's right.
Then I remember that 10, 15 years ago, they were lifted to Hong Kong.
Right.
And now there is no need that.
Now there's no need.
No need.
Actually, expats, to be honest, Jargal, they're a very, very small part of our business.
I see. Okay.
Only 3%.
Oh, I see.
97%, more than 97% are Mongolians because, frankly, we are a Mongolian hospital for Mongolians.
Yes.
Now, we're foreign managed. That's true. We have.
So
go ahead.
That's what is about. You are you're sort of representing as a foreign manager in the country at the United Family, right, in the U.S.
United Family Healthcare.
Yeah,
that's right.
healthcare. What is that about?
United Family Healthcare is a company that is an American company, but operating hospitals in Asia.
I see.
Predominantly in China. And we've been operating hospitals now for 18 years. With United Family Intermed Hospital, I believe that makes our 7th or 8th hospital.
Oh, I see. You have a whole chain in Asia.
There's a chain. I believe it's 7. I have to count, but I think it's 7 hospitals now.
Okay, and you were part of also China.
That's right.
Okay.
That's right.
You were living there, or?
Yes, I'm living in Asia a long time, over 10 years.
Okay.
And United Family Healthcare, as I mentioned, started 18 years ago in Beijing, and then spread. It's an American-owned company, but spread
All around China or Asia?
all around China and now into Mongolia.
Okay, this is the second country in Asia, actually.
It's the second country in Asia. That's right.
All right. And what was the sort of, was it easy to work in China? I will compare it with Mongolia afterwards. So
Sure.
what was the challenges you had in
The challenges
China?
for healthcare in Mongolia?
in China, yeah, while you were operating there.
Sure. The challenges in China for healthcare, I should say that United Family Healthcare is the largest foreign provider of healthcare services in China.
Okay, still now.
Until now.
Yes, okay.
Still now. But only 7 hospitals. So you can imagine the Chinese market is huge.
Yes.
We're talking about 7 hospitals in a huge country
Okay.
of 20,000 more hospitals. So
Okay.
we're a very, very small part, but we're still the largest foreign part.
Okay.
The challenges there are actually quite similar to the challenges here. And I think the challenges are 3.
Yes.
1 is regulation.
Okay.
2 is resources. What I mean is medical resources. And 3rd is medical culture. And medical culture in China is different from medical culture in Mongolia, is different from medical culture in Germany and America and Japan, and all over the world have different
What do you
medical
mean?
cultures.
Like, take one case, for example,
I'm an American.
Yes.
As a kid and growing up, people like me were used to primary care.
Yes.
Primary care means, and I don't feel well, my mom and my dad take me down the street, and there's a doctor, and
Quite close to your
and
area.
a little clinic, and he'll say, you have a fever, take some antibiotics, if it gets worse, call me back, go home,
Yes.
drink lots of soup.
Yes.
Okay. Here, and I would go to him whether I have a fever or whether I have a broken leg or chest pain, anytime you go to the primary care physician first. Then she will refer you up to a specialist. In China, it's completely different. They go directly to the specialist. And what that means for China, which is the world's largest country by population, is that the specialist hospitals are overwhelmed with people.
In case here too.
Exactly right. So with the medical culture, what that means is when you start a facility that's a foreign-owned facility, you bring in foreign doctors, you bring in foreign ways of practicing medicine. Many of the Chinese people say to themselves, well, I still want to go directly to the specialist. And because of the system, the best specialists are at the biggest hospitals. And so when you start a small private hospital, it's very hard for people to believe that you can provide the same quality of care that the specialists in the big hospitals provide. We have shown in China that that's not true, that in fact the care is at the same level or sometimes even better than the public hospital systems. I'm not saying the doctors are better. I'm saying the care is better. So I make a distinction there. The doctors are just as good, but you get more care, more time with the patient. In China, for example, at a big public hospital, the average number of minutes that doctors spend with their patients is 4. 4 minutes. Right. An average internal medicine doctor will see between 50 and 70 patients every day.
Whoa.
The country's huge, right?
I
Lots of
understand.
people.
I think some of our doctors do the
Yeah.
same almost.
Yeah. And in Mongolia here, so 4 minutes is not enough. I can't even learn your name in 4 minutes,
Yep.
let alone assess your condition.
Sure.
Now, we've taken it so that you will have lots of time with your doctor. She will be able to answer your questions. He will be able to say, tell me what's wrong, let me teach your medical history, let me understand your full condition, and let me then follow up with you, do tests, and then follow up with you in a few days.
So
That is premium care, and that's what we're bringing to Mongolia.
and also the same was in China, I understand.
Right.
In terms of regulation in China, what is the difficulty?
The regulation in China, both China and Mongolia come from a similar socialist
Communist
background.
yeah.
And the way the healthcare system was set up is quite similar in the sense that they've created primary, secondary, and tertiary hospitals. The regulations are such in China are actually, I must say, more difficult than the regulations in Mongolia. Mongolia is a more open market than China for healthcare. But the regulations basically have to do with who can start a hospital. Until 2010, foreigners could only own 70% of a hospital.
In China?
In China.
Okay.
So you needed at least 30% owned by a local company.
Now?
Now they've opened it up, but they've only opened it up in 7 provinces.
Okay.
So it's still quite difficult. So if you were a foreign investor from Singapore, from Mongolia, from America, before you had to find a local partner, up to 30%. So in our 18 years of operating hospitals, most of our hospitals have that joint venture structure.
Okay.
Quite difficult to do business in that way because
Okay.
because you have to find the right partner, and then of course finding partners can always be a challenge. I think we've been quite successful in China, but we've been lucky.
And yet you are hired here as a professional manager.
That's right.
For a Mongolian, Intermed is a Mongolian company.
It's a Mongolian company.
Run by professional American management.
That's right. It's actually only the second time, to be quite frank, that we've tried a management approach instead of an ownership approach. Tried once in China, and we're trying here in Mongolia. I must say that this experience here has been much better, much different and much better than our experiences running as a manager in China.
Running is one thing, but the doctors, are they Mongolian?
We have 50 doctors.
Okay.
Most of them are Mongolian. We have several foreign doctors.
Okay.
We have a French surgeon, we have a Cuban dentist, and we have some other foreigners. Importantly, all of our Mongolian doctors, I would say not all, I would say most of them also trained overseas. Korea.
Well, that's what I have heard, that Mongolian doctors who used to work abroad are coming back to your hospital.
That's right. They're coming back from Germany, they're coming back from the States, they're coming back from Korea, some from Russia.
I mean, they were not coming back, and then suddenly they are coming with you. What makes them to do so?
I think it has to do with the what we're offering them. I don't mean money. What we're offering them is a chance to change healthcare in Mongolia. These doctors, most of them practiced for a long time in the public system here, and were very successful, and then went abroad to study, and maybe came back recently. But what we're offering is something like what they saw in Germany, what they saw in France, or what they saw in other these places. The idea that we are patient-centered.
Okay.
So our practice of medicine, I mentioned, a long time with the patients, understanding everything about you.
Sure.
We are patient-centered. We're evidence-based. So evidence-based medicine means we go with the latest scientific research on your condition to treat you. Not what we learned in medical school 20 years ago, but what the latest research is. And so we require all of our doctors to be up to date. If there's a new study from Sweden showing that this is a good way to treat diabetes.
Do you help them to do so?
Of course.
You have a network around the world?
We have a network. We finance it.
Okay.
We require it as part of their employment.
So you are sort of training those doctors, also updating them with.
Yeah. Well, I wouldn't say we're training. We're updating them. We're making sure that they're current. We're also training junior doctors to be in this kind of patient-centered care.
Well, I see. Where?
At the hospital.
Would be training.
But we're also sending them abroad. So we've sent some to Korea, to Taiwan. We're sending one to Austria. So we have this.
For a young doctor, say just graduate or being graduate now, do they have any chance, and what kind of chances would they have with you?
We are currently hiring young doctors as a way to bring them into our system early. So emergency medicine, dentistry, places where physical therapy, places where Mongolia is just starting to grow. Let me give you an example. Primary care, family practice. The family practice is not well understood in Mongolia. It's not well understood in China. It's not even well understood in most parts of the world. But it's true that a primary care physician can treat probably 70 or 80% of what's wrong with you, what's wrong with me. Or at least we call it triage it, which means push it in the right direction.
Okay.
So, but there's no history of that here.
Yes.
The government in its 5-year plan for the healthcare system the Mongolian government put primary care as one of the areas to focus on. Primary care also includes prevention, something that is very hard to do across the world, because people don't go to hospitals unless they're sick. We want to get them before they're sick to make sure that they stay healthier longer. That's a very difficult thing to do for any country. So primary care physicians are one thing we're trying to implement here. And sorry, go ahead, please.
Yeah, my question is, you have just talked about emergency, and we had up to now problems, difficulties with really emergency, effective, on-time help.
Right.
And in that regard, you have also emergency department?
We do. We're a tertiary hospital. We have an emergency department.
Okay.
What I consider, and I don't want to be too marketing about this, but I do consider the best ICU in intensive care unit, at least in the private sector in Mongolia. So we have these facilities available.
So what makes different? What makes your emergency department or unit better and different than the existing ones in the country?
Well, let me give you an example of the intensive care unit, for example. Intensive care or critical care is
No, it's really critical. I mean,
it's critical.
Your life depends on that
So,
quality.
for instance, of course, so we have all of the latest equipment from Korea, from Germany. All of our equipment is imported. We have doctors who have trained in intensive care all over the world. We're staffed 24 hours a day. We do things that people don't do in other parts of the country. For example, something called CRRT. It's continuous renal replacement therapy. When your kidneys are failing, you have to run your blood through a cleaner to clean it.
Yes.
But hemodialysis is another thing we do, which is...
So it's sort of a machine is recircling your blood.
Exactly, cleaning your blood, because your body can't do it.
Yes.
So it's cleaning this.
Oh, okay.
So hemodialysis is done in stages. You do it for an hour, you do it for 2 hours on the machine, then you go home. But continuous means your kidneys are failing, you have to have it all the time. I believe we're the only private hospital doing it. So if you have, we have very high rates of liver failure in Mongolia.
Yes.
Liver disease is the number, I think either the number 1 or number 2 cause of death in Mongolia. We're specializing in liver and kidney disease at Intermed because we understand that's what the local population needs.
Yep. Emergency. The other thing is, you yourself are not doctor.
No, I'm not.
No doctor.
No.
You are management.
I am.
You have done the Stern School of Business, Columbia, right?
NYU.
MIU. Oh. And you have done also London School of Economics.
Yes.
University of Virginia.
Yes.
Quite good names of schools.
Well, thank you.
And you're running management here, and then why I'm asking this question is, you have, well, not the best in the U.S. I used to live there, also studied there. Not the best, but still quite good functioning healthcare system. But the issue is the insurance part of it. How do you find this insurance part of things in Mongolia?
Well, let me say I completely agree with you that the medical care in the U.S. is good. The payment part of it is a disaster, right? And
I've seen that.
whether you like Obamacare or you hate Obamacare, it doesn't matter. Fundamentally, you must agree that Obamacare is a debate about how much the government should do and how much the private sector should do. Private insurers versus government insurers. In Mongolia, I believe that the government is also having the same type of debate. In fact, I think the health minister, the parliament members, the cabinet, the prime minister are thinking about the healthcare system. What should they do? Who should pay and who should provide? In China, they're having this debate. Actually, globally, they're having the same debate between government and private sector provision of healthcare. In Mongolia, the insurance market is almost zero. Private health insurance market. The national health insurance market works quite well, I think. It needs some reform, but it's actually working quite well. So hospitals that are accredited by the government can then be reimbursed the national insurance rate for medical services. But I think there's huge opportunity for growth in the private insurance market. A few insurers are already in that market, but they're very small. I've heard that a few other private insurers here are looking to get into the market. But you're talking about people covered in the thousands, not 10,000s or 100,000s, thousands of people, very, very small. I think if you look at the pyramid of income in any country, the top people, the wealthy people, the very white-collar workers, these guys will probably be covered by private insurance.
Private insurance.
Eventually. Now they're paying out of pocket, cash pay. But eventually they'll get to insurance. The bottom part will be covered by national insurance. The question is, in my mind, is this middle class. How do we provide healthcare services to the middle class? Intermed Hospital is a new hospital. We are also, we're also relatively a premium provider relative to other hospitals. But we're quite concerned about how to tap into the middle class. So we've started a membership program, for example. A membership program, essentially a discount program to allow people in that middle tier to access our services, our premium services. Because I believe that's the growing class in Mongolia. We want to be able to serve not only, we're not there to serve the top 3, 5, 10%. We're there to serve the top percent plus the middle class. To be honest with you, we will not be able to serve everyone. We shouldn't.
Sure, certainly.
Of course.
And of course you should not. So this is the way, what is today insurance and medical care situation in the country, and I think what you do is bringing exactly that standard, and I think those who were with you, who are coming to you, are very happy. And I would like to congratulate you guys and you particular for running this business, and I wish you good luck.
Thank you. Well, it's a team effort, and the team we have there is superb.
Exactly.
Yeah.
That's one day every manager should say or could say about their team. Thank you very much.
Thank you, sir.
Thank you. За хүн төлөвчтэй өнөөдөр манай de facto нэвтрүүлгийн зочноор Интермед компанийн гүйцэтгэх захирал ноён Джошуа Курциг оролцлоо. Их баярлалаа.